My name is Richard Cooper, and I'm running for president in 2020. Today I have some questions. How do we fix our healthcare? What's wrong with our healthcare? Is it that the price is too high? And why is that price so high? Do we care about our health? Do you? Do you care about the health of your spouse, your children, other children, your parents? What about veterans, employees? What about your employers, our coworkers, and their families? What about people living on the street? What is wrong with our healthcare? Why are we so sick? Is poor health something that happens just from age? And why does it seem like my grandmother is healthier than my dad? Could there be a lot of reasons? Or maybe it's just a couple. What is wrong with our healthcare? I mean, what is healthcare supposed to even do? Does our healthcare system actually care about our health? Is it supposed to? Was it designed to? I mean, really, what actually is being healthy? Is it just being alive? Is being healthy just about being able to work? I mean, if so, I understand why they prescribe so many painkillers. Is being healthy just feeling no pain, though? Is it keeping us free of disease, maybe? Where do these diseases even come from? Does it come from bacterial germs and viruses? And if so, are all bacterium even bad? Furthermore, why does everything have to be antibacterial? We have all these antibiotics and they're not working like they should have. I mean, are the viruses in those vaccines okay? Does that mean that the vaccines are bad? I don't think so. I don't think vaccines are bad, but are all vaccines good? Could it be that maybe things are just unbalanced? What is wrong with our healthcare? Again, I ask, what is healthcare supposed to do? If being healthy means to be balanced, doesn't that mean that both the mind and the body need to be balanced? I mean, life's not very good if you have one without the other. It doesn't even really seem like life. If your body's feeling good, but your mind's gone, are you healthy? And if your body's all broken down, but your mind's still there and you're experiencing it, doesn't seem healthy either. Man, what is wrong with our healthcare? Is that price really too high? I wonder what should be the price. If being healthy means having a balance in our mind and our bodies, is there a good price? Should there even be a price? Maybe it should be free. I have to ask, why is the price what it is? Is it because doctors charge so much, maybe too much, or is it the hospitals and the board executives, they're charging too much? Or is it because the insurance companies, are they charging too much? Or maybe it's the government's fault. Or do we blame somebody else? Do we blame the fast food industry? Or no, maybe it's the marketing companies that are marketing the fast food to us. Or no, maybe it's the food manufacturers or the companies working on GMO pumped up meats, dairy, vegetables, fruits, or it's the corn syrup, or the pharmaceutical companies, or the congressmen that take the donations from them. What is wrong with our healthcare? Now, back to the price. What makes that price what it is? Is it set from greed and trying to gain some profits out of people? Or is it to cover some expenses? Maybe it's both. And what's happening to those profits? What are the actual expenses? Do we have to pay doctors and the nurses, the hospital staff, the administration, and all that? I wonder, what does it cost to become a doctor? Do we even have enough doctors and nurses to take care of all of us? What is wrong with our healthcare? The truth is, I know what's wrong with our healthcare system, and I know how to fix it. You see, we're unhealthy, and we're making unhealthy decisions about our health. If we work on our health, then the burden is going to be lessened on the healthcare system that's already strained. And with a lower demand, the supply will be at an excess instead of a deficit. And with a surplus of healthcare professionals being able to focus on the people that are actually needing it, and with less sick people, each person is going to be able to get the proper attention that they need. Culture is something that we get to focus on when we have spare time. Without spare time, culture doesn't develop. And there is no spare time in the healthcare field right now. But if we can give them some time so they're not under such pressure, then the actual culture of healthcare will change. What's wrong with our healthcare system? What's wrong with our healthcare? It's that we don't care about our health. My name is Richard Cooper, and I'm running for president in 2020. See you soon.